Hi everyone, we're here today to talk about ABGs. We're going to go through a little bit of the safety aspects, we're going to look at the equipment, and then we're also going to demonstrate how to perform an ABG. So much like cannulation and phlebotomy, our ABG syringes also have a sharp safety device. A bit trickier to use than the other ones, but we'll show you a few tricks for how to do that later on. And obviously sharps, straight to the sharps bin that we will take with us to
not in the tray.
Not in the tray. Also, we wear gloves every time we take an ABG, and clean the patient's skin using our 2% wipes.
As part of the preparation that we want to do before we actually perform the ABG, we need to just do all the things that we do when we're taking any kind of sample from a patient. So introduce yourself, say the reason why you're there, justify it if you need to, and then make sure you get consent, and then identify the patient correctly. So you might be doing this test, via e-care in the lab, you might be doing a quick test, and so you've got to follow the correct procedure for doing that. So we want to make sure that we get our patient decide where we're going to be taking the arterial blood from, and we might just ask the patient which arm they prefer, and whatever arm they prefer, we must make sure that we check the blood supply for their hand. So we're going to be taking our arterial sample from the radial artery, and if we do damage the radial artery sufficiently, we can actually reduce the blood supply to the hand, so much so that it becomes ischemic, and then they might actually end up having that amputated. So we want to completely avoid that. So in your hand you have the ulnar artery, which obviously supplies blood to your hand. So we need to check before we perform the ABG that the ulnar artery blood supply is going to be sufficient to keep the hand perfused. So we're going to do that by performing a modified Allen's test, and you need to do this every time you do an ABG. So what you want to do to perform that is you would want to make sure that you take your thumbs, put your hands below the wrist, and push down on the arteries, both sides, occluding them so you're stopping the blood supply, and ask the patient to form a tight fist. While they're doing that, count down from 5, 4, 3, 2, 1, and get them to release the fist, and you'll take note of the fact that the hand looks now white. Now release the pressure on one side, you'll notice that you will see blood supply returning into the hand, and that blood supply has to return within 10 seconds, then you can release the whole hand. It's important that if the blood supply doesn't return to the hand within 10 seconds, then that is a positive Allen's test, because you found a clinical sign. And if you see that, then the blood supply in the ulnar artery isn't sufficient, so you'll then move to the other hand and check that one. And if they're both insufficient, you would then need to speak to your supervisor to be able to decide what you're actually going to do. Once you've checked that, you can then know which wrist you're going to be using, so you then want to make sure you get the patient in a good position, and so that is supinated and extended, not hyperextended but extended, and we want to make sure that when we're doing that, if you're doing it to an older person, or getting an older person to be in that position, they might find it a bit hard to turn their hand over with their hand straight in front of them, so having their hand out to the side might be more comfortable for the patient, especially older patients. If your hand's got to be extended, you need something underneath it to support the hand, and you would think about using a pillow, but actually they can collapse. So using a rolled up towel or a blanket's good because it's a bit more firmer, so it's something more stable that you can actually rest under the wrist until the hand can drop down nicely. Once we've done that, we then need to think about the fact that if we want to be able to locate where the artery is. So if we're going to be doing that, we need to obviously palpate the artery, and you can do that in the normal way that you would feel that, taking note of any structures that you might see. So I know on this hand I've got a vein that travels along my artery here, so you can't stick the needle through the vein, it has to be avoided, tendons and things like that. And then we want to locate the artery properly. So if I was going to do that on a patient, and everyone has their own way of doing it, I would put my finger, so my finger is pointing up the arm, and feel the artery and get the main pulse to be right in the middle of the tip of my finger, so that when I wanted to insert my needle, I could aim my needle right in the middle of my finger, and then I know I'm going to be accurate. Some people have all sorts of different ways. One we don't recommend is when people put the needle in between their fingers if they're holding that position. We don't recommend you do that, and so please try and avoid doing that. We want to make sure that we try and be as accurate as possible, so you might want to landmark it by looking to see if there is any kind of mark on the skin that you can line up to. But if there isn't, one thing you can do is if you take your fingers, and you can do that now if you want, if you take your nail and push it firmly into your skin and hold there for 5 seconds, 4, 3, 2, 1, and then take your hand away, you'll notice that you've left a little indent with your nail. If you take your hand now, rub that indent, you'll notice that it turns pink, so that's something that you can line up to if you want to use that method. It works. Some people say that ABGs do hurt more, and I probably think that's true, obviously not when we do them, please. But one way to try and avoid pain for patients is to actually perform some skin traction when you stick the needle in, because that will obviously deaden the feeling that they can of the actual nerves, and also making sure that you insert the needle very slowly, because some people do insert it quite fast. One thing to take note of when you're talking about inserting the needle is that you want to really work out not just where the artery is left and right, but also how deep it is. And you can work that out by, if you push very lightly and you can feel a very strong pulse, then you know that actually the artery is very shallow. But if you have to push quite firmly and you've left quite a big dip in the skin with your finger, then you can feel a pulse. You know that the artery is going to be quite deep, and that really helps you trying to work out how far you've got to push the needle in before you know that you've absolutely missed it. Anything else I'm forgetting?
No, I was just going to mention about the sharps when you spoke about the two fingers. There's obviously a bit of a higher risk with sharps induced than ABG because of your sort of proximity to the patient. Sometimes they have a tendency as well just to kind of move their wrists a little bit, so just be aware of that.
It's a close contact skill, is it? So you've got to be very, very careful. So I think that's it for preparation and for safety. So our next video we'll talk about just the equipment they're going to be using and the actual procedure. Thank you.